My name is Otieno. I'm the clinical officer in charge for the facility, that is Ndhiwa Sub-County Hospital. And I'm also the deputy gender-based violence focal person in the sub-county. Within the sub-county hospital of Ndhiwa, one of the burdens in terms of numbering diseases we are handling is cases for gender-based violence. And gender-based violence itself is regrouped into different classes. Majority of the bigger part we are attending to is cases of defilement. And it is the biggest burden that is facing us as a facility. Among the groups, the age group we are attending to most are the teenage ages. If you check behind me, is the clinic where we are attending to these cases. When they walked into the facility, if you check our data keenly, most of our referrals come from the police. Majority of the victims believe that when they are faced with such like cases of gender-based violence, their first stop is at the police. So they reach the police first before they come to the hospital. That is when they are escorted to our facility and we are attending to them. Basically, as a part of improving the service and what the sub-county is doing as a whole, and the county government of Homa Bay, we are trying to create awareness that in terms of such like cases, they really need to walk to the hospital first so that we don't delay in terms of offering treatment and delay in terms of collecting evidence. In the facility, as part of what we are offering, to these cases of gender-based violence in our clinic, we offer what we call clinical examination and clinical treatment. And we also do offer counseling, which plays a very big role in terms of management. Most of our cases are very young minors, majority ages below 15. If you check our data, majority are 10 to 15 years of age. So they're benefiting on the counseling part of it as our biggest treatment. So part of what we offer as the hospital, apart from the clinical examination, we are also able to do the laboratory works, which the hospital is offering free of charge. And by offering this free of charge has a little bit improved our services. Initially, those who are affected were thinking that you look for money for the treatment before they walked into hospital. But since the awareness has been done and majority are now understanding that the treatment is free of charge, they are walking in and the number is improving. Between March up to now alone, we've attended to more than 33 cases. That's a very big number within a span of 3 months. And that one can conspicuously speak as to why it is a problem for the sub-county. If you check the other side of gender-based violence, that is physical violence, between March up to date, we've seen 40. The number is quite alarming. And that's why we are saying it is a burden in terms of the diseases we are attending to. So in our laboratory, as part of the treatment, we are able to offer the clinical examination, the lab works, and we are also doing or collecting the DNA samples that we are feeding to the government chemist. So apart from what we are offering in terms of treatment, we are also doing free P3 form to these cases of gender-based violence that is in support by the hospital and the county government of Homa Bay. So these cases of gender-based violence, what we also need to talk about that can help us reduce the number is that if we can get enough support for awareness creation in the community, we'll be able to register quite a number of cases and also able to at least reduce the number of cases of defilement and generally gender-based violence. In terms of factors that actually are affecting our management, considering what we are having in our data, the biggest factor is late reporting to the hospital. Most of them are coming to the hospital late, of which I had explained that what we are doing as a facility is to tell them that the treatment is free of charge, so they need not to have a reason of reporting late. So we are working hard to make them know that the treatment is free. They need not to look for money and take a lot of days. That is affecting our results and forensic evidence at the end of the day. The factor is the kangaroo court. The kangaroo court is actually affecting our management of gender-based violence outside. And this is a group sitting down somewhere and making judgment in terms of offering and mediating between the affected persons so that they can get payment and drop the cases. When these victims realize that this can take place, they're actually not coming to the hospital because these people are managing themselves at the community. So in terms of the overall effect of gender-based violence, it is directly connected to the HIV AIDS. In fact, majority of our people coming late to the hospital, we are not able to prevent HIV AIDS. When they report earlier, we are able to give prophylaxis against HIV and we are able to control. But considering the data we are having, those who are reporting late are later turning positive for HIV AIDS as a result of sexual gender-based violence. So it is directly linked to the high rate of positivity rate of HIV AIDS in Homa Bay as a county, simply because majority of them are coming late and we are not able to offer prophylaxis.